Every Thursday night, for years, they gathered in the same place. Not a clinic, not a church, a screen. 30 small windows, 30 people scattered across the country, most of them in more pain than you have ever felt. They came for one man, and for 1 hour, in a calm Kansas voice, he told them the thing almost no one else would say. You are not hopeless. There is a plan. Do not give up. This Thursday, the windows opened. This Thursday, the windows opened the way they always do. But the chair at the center was empty. Let me tell you about the man in that chair. Forrest Searles Tennant did not set out to become the most important pain doctor in America. I was one of those 30 windows. Let me tell you about the man in that chair. He started in public health, asking what quietly hurts whole populations. He trained in Kansas and in Louisville. He served in the Army and the Public Health Service. He taught at UCLA. He became one of the nation's early experts in addiction medicine and drug testing. He was trusted by the FDA, by professional sports, and by the Drug Enforcement Administration. Then, in 1975, he made the choice that shaped the rest of his life. He opened a clinic for the patients medicine had given up on, the ones on feeding tubes, the ones in wheelchairs, the ones every other doctor had quietly shown the door. He did not look away. He pulled up a chair. The patients who found him carried names most doctors had never studied. Adhesive arachnoiditis, where the nerves at the base of the spine are slowly bound together, in a knot of scar and fire. Ehlers-Danlos syndrome, complex regional pain syndrome, once called the suicide disease for what it does to a human being. For decades, the world called all of this simple chronic pain and told patients it was in their heads. Tennant said no. Severe, unrelenting pain, he argued, becomes its own disease. It punishes the heart. It collapses the hormones. It can shorten a life. He gave that truth a name, intractable pain syndrome, and he found the fire underneath it, neuroinflammation. Deep in the brain and the spinal cord, immune cells switch on and never switch off, burning through the very wiring meant to control pain. And a mechanism you can name, you can fight. He looked at the scans. He looked at the scans and said, this disease is not rare. We simply never knew how to see it. No drug company ever built a cure for these diseases, so he built something better. A plan a frightened patient could follow and an honest doctor could respect. He called it the 3-component protocol: control the pain, calm the inflammation, and help the damaged tissue heal, so you are not only masking the disease. In his last years, he went deeper still. He traced autoimmunity to an old virus, Epstein-Barr. He showed that the decline everyone called unstoppable could be stopped. That was everything. You would think a man like this would be protected. He was not. On the 15th of November, 2017, 24 armed agents raided his clinic, his home, and his foundation all at once. With news helicopters circling overhead, they hauled away decades of research. The headlines convicted him before lunch, and then nothing. 18 months of silence. No charges, no indictment, no trial. The DEA closed its case. The medical board dropped its complaint. More than 200 doctors vouched for him. He was innocent. He had always been innocent. But damage like that does not undo. His patients were cut off overnight. Some of them did not survive it. At 76 years old, Forrest Tennant closed his doors for the last time. They took his practice. They could not take his purpose. He turned his foundation into a lighthouse. He wrote the handbooks, plain and cheap, so anyone could hold the science in their hands. He answered letters from strangers, and every Thursday he got back on that screen. For his last few Thursdays, he ran the call from a hospital bed. Press jacket, calm as ever. For his last few Thursdays, he ran the call from a hospital bed. Press jacket, calm as ever. He reached into a crowd, finding an unknown voice and raising it. I need to tell you something, because it is the truest thing I know about him. A few months ago, this man reached into a crowd of strangers and pulled me out. He set me down on that Thursday call, among people I had no right to sit beside. I never gave Forrest Tennant a single thing. I was a taker. He was a giver. One of the last questions he ever answered was mine. I almost let it go. A question on the seam between the clinical side and the biochemistry underneath. I figured it was the dumbest thing he had ever been asked, or he would see the thought I had put behind it. He lit up. He raved about the thinking. And for one moment, a man in his last days made me feel like the smartest person in the room. That was his gift, right to the very end. This Thursday, I logged in like always. Then the producer came on and asked us all to mute. Miriam, his wife, told us he had left us that morning. I watched 30 people break, all at once, together, the way he taught us to do everything. Forrest Tennant spent 50 years refusing to abandon the abandoned. He gave the hopeless a diagnosis, a protocol, and a reason to hold on. He made an invisible disease visible. He made frightened people feel seen. When his own government tried to erase him, he answered one way. He kept working. So now, we show up for him. Learn the protocol. Support the research. B-roll footage. Protect the doctors brave enough to do what he did. Don't let them be railroaded. He kept showing up. Now it is our turn. Rest well, Dr. Tennant. Travel well. Visit arachnoiditeshope.com to continue the mission of Dr. Forrest Tennant. Stay curious. Stay informed. Dr. Harvey. Brought to you by Bedside Manners, honoring courageous physicians everywhere.